Hello, I'm Harold Phillips, the Director of the White House Office of National AIDS Policy. And I'm very happy to be with you, although virtually today, to talk about the National HIV/AIDS Strategy and what it means for Black gay men. I also want to have just a moment to thank the organizers of the conference. This conference is not an easy feat to put together on an annual basis. And you all usually have this conference at a time in early January, just after everyone is back from the holidays, just after we've had the chance to refresh and renew ourselves and also recommit ourselves to the fight against HIV and also figure out how to improve both HIV prevention, care, and treatment services for Black MSM. So I'm going to talk today about the national strategy. I'm also going to give just a little bit of context for some of what's in the strategy and why. I'm also going to talk a little bit about the Ending the HIV Epidemic initiative and the Biden-Harris administration's commitment to ending the HIV epidemic and how it connects to the national HIV/AIDS strategy. And then finally, what is it that we must do as a community to recommit, to rededicate ourselves, to re-energize the HIV response so that it is more tailored to meet the needs of Black MSM. So in terms of where we are in the United States, and this is information that many of you who are in the audience and watching this today already know. 1.2 million people in the United States living with HIV. 13% have not been diagnosed. When it comes to viral suppression and its importance and the things that we're learning about effective and durable viral suppression, only 57% of the people with HIV in the United States total are virally suppressed. We have about 34,000 new infections each year. And without intervention, in another 10 years, we'd have nearly an additional 400,000 people in the United States living with HIV. As I'll talk about later on, we have all of the tools necessary to end the HIV epidemic. These slides come from the Centers for Disease Control, and they show where we were in 2015 compared to 2019, which is the year for which we have the most complete data. And you can see that there has been a slight drop off. New HIV infections fell 8% during this period after being pretty stable for a number of years. But and this is the importance of data that is what we call disaggregated by race and ethnicity. When you look at the data more closely, you see new HIV infections by the most impacted populations in the United States. African American, gay and bisexual men are that first bar there at the very far left of the screen, that first set of bars. The sort of spotted bar represents 2015. The solid color, almost turquoise bar is 2019. And you can see for African American, gay and bisexual men, there is not very much progress between 2015 and 2019. So in the previous slide, when I talked about hopeful signs of progress, you need to go over 3 bar sets here from the left. So first, we've got African-American gay and bisexual men, then still moving left to right, Latino gay and bisexual men. Again, not very much progress. Where the hopeful sign of progress is, it's among white gay and bisexual men. The other thing that I like about this chart and why I show it is that it also highlights proportionately where different groups are with the HIV epidemic from those same years, 2015 to 2019. So as we continue to move left to right, you'll see after white gay and bisexual men, African-American heterosexual women. So among Black women, we also see not very much progress, but we also see proportionately where they fit in to the HIV epidemic. Moving again left to right, our next set of bars, so that would be our 1, 2, 3, 4, 5th set of bars there, people who inject drugs. And this gives us some pause because we're moving in the wrong direction with this group. You see, there is not a decrease, but an increase. Some of this is opioid use. Some of this is crystal meth injection use as well. So we're paying attention to this, and we're also paying attention to groups where we don't have a lot of progress. This is another way to show this just for the year 2019. And you can see by the purple in this donut graph, where Black and African Americans sort of fit into the entire pie when it comes to thinking about HIV and the year 2019. And so this shows us really where and how we need to be thinking about which groups are most impacted and where we need to change some of our approaches to ensure that we are meeting people where they are and that we have prevention, care, and treatment services that are culturally appropriate and tailored to the communities most impacted by HIV. Again, we see HIV incidence in our 13 to 24-year-olds decreasing over this time period of 2010 to 2019. I think this is a result of a number of our efforts, but we don't want to give up on our young people. While our HIV incidence trends by age have gone down in this cohort group, we also are concerned about the rates of STI infection among these groups. So while they're not getting HIV, they are experiencing other STIs. The other thing that I want to point out here is that of 24 to 34-year-olds, we see that that our HIV incidence has more than doubled during this period for this cohort. And when we think about Black MSM and we think about that age group, that's the age group where we're either definitely out of high school, we are out of college, we are getting a little bit of income, we are living independently, we are working, playing, and worshiping in spaces that are different from when we were 13 to 24. So what this tells us is that we need to be paying attention to the fact that some of our interventions need to be tailored because we're missing this group. The Ending the HIV Epidemic initiative focuses on the areas of the country where we have 50% of the new HIV diagnoses existed in those 48 counties, DC and San Juan. We've also focusing on 7 states with the most substantial HIV diagnosis in the rural areas. The 75% reduction by the year 2025 and the 90% reduction by the year 2030 are also important because they're part of the national HIV strategy as well. So while we're focused on these areas of the country that account for 50% or more of the new HIV diagnosis, everyone in the country, even if you're not in one of these jurisdictions, needs to be focused on how we can end the HIV epidemic. What this also means is that there are some areas of the country, or there are other areas of the country that are not contributing and accounting for more than 50% of the new HIV diagnosis. That means that in many ways, you're doing some things right. And so the national strategy talks about this and talks about the fact that it's a nationwide effort to end the HIV epidemic, and that we need to be learning from each other and borrowing ideas and approaches so that we can help ensure our success. I spoke briefly about this, the tools that we have to end the HIV epidemic, and there are more tools that are on the horizon as we think about injectables and implantables and what that means for both HIV prevention and treatment. It's going to be important that we ensure that there is access to these tools, because the tools are no good if they're just here and no one has access to them, then no one has awareness of them or how to use them. So massive effort, both community to help drive demand for access to the tools, changing our systems and our structures to help ensure that there is access, and training our health workforce to help ensure that we are able to deliver prevention and treatment tools to those most in need, especially Black MSM. So let's talk about the National HIV/AIDS Strategy and what it means. It's very aligned with EHE. I already talked about how the goals definitely align. So while we're focused a lot on 2030, 2025 is a really important year for us. President Biden has called for us to accelerate our efforts to address the HIV epidemic. and has used the national strategy as this platform to help galvanize the nation around these goals with certain objectives to help us meet that goal of ending the HIV epidemic, but paying attention to the importance of 2025 and how we need to continue to focus on the populations that are most in need and looking at ending the HIV epidemic, not only as a disparity initiative, but also thinking about what this means for equity and health equity in particular. So it's an important overall component of our work. The Office of National AIDS Policy will continue its involvement both in EHE, which is being run out of HHS, and coordination with the National HIV/AIDS Strategy. Strategy has an overall redesigned vision, 4 goals, objectives for each of those, and strategies for each objective. Focuses on priority populations and also includes indicators for our progress. And this is the new revised vision. And what I'd like to point out about this vision is that it is a vision of where new HIV infections are prevented, where everyone knows their status, meaning that there is access to testing, and every person with HIV has high quality care and treatment that is free from stigma and discrimination. And also thinking about helping individuals achieve their full potential for health and well-being across the lifespan. So aging, as we age as a nation and address the HIV epidemic, that we're dealing with the issues of stigma and discrimination. And a much more inclusive vision of our nation as well. And I think as you think about things that you have heard this administration talk about, this vision reflects those values as well when it comes to our HIV response. Focus on priority populations. Based on the data that I showed you earlier, we used incidence diagnosis and viral suppression data to help decide who would be the priority populations where we would focus our efforts as part of the national strategy and also EHE. You'll note that the strategy also includes transgender women. I didn't include the data slides on that group in this presentation, but it is we do have it. And our data also shows the disparity that happens with this group as well and the need to tailor our HIV response. On the screen now, you have the 4 goals that are here. The goals have been tweaked as well and revised, and each of the goals is also measurable. The 4 pillars, as we talk about, diagnosing all people with HIV as early as possible. So really and truly scaling up HIV testing. How do we move HIV testing from the clinic to the community? Also treating people with HIV rapidly and effectively. So what are both the support systems that individuals need, as well as access to medications and clinical care? And how do we do that quickly rather than a week? In many places, we're moving to rapid. We also need to be moving towards same day treatment for HIV. Preventing new transmission and using all of the tools that also include PrEP, syringe services programs, condoms, behavior change. And I like to say, making sure that individuals know the options, because PrEP doesn't necessarily work for everyone in their lifestyle. So give people options and a combination of options to prevent HIV transmission that work for them. And again, we have new tools coming on board, injectables, implantables. And so how we integrate those and make sure that there is more choice is also going to be very important. And then finally, responding to potential outbreaks of HIV to get needed prevention treatment services to people who need them. And that's our sort of molecular response pillar. So in developing this strategy, several things happened as part of the revision. And these revisions also included input from the community, as well as input from the federal partners. Recognizes racism as a serious public health threat that we need to address. Calls for a better integrated response of HIV, viral hepatitis, and STIs, as well as substance use and mental health disorders. The importance of harm reduction and syringe services program. It underscores the vital role of the Affordable Care Act. adds a new focus on people with HIV who are aging, enhances the focus on quality of life for people living with HIV, and calls for us to both focus on priority populations and geographic areas of the country where we are disproportionately impacted. Also, the role of people with lived experience. And I think as Black gay men, our lives are still very misunderstood and not understood. And so we need to be part of the response. We need to be at the table when it comes to research, when it comes to needs assessment, when it comes to planning for both HIV prevention, testing, and care services. Also, implementation. So being part of the service delivery, working in clinics, being community health workers, being nurses and doctors. And so making sure that that lived experience is reflected, and also in government to help shape and mold both policy, program, and planning for our communities. Also, weaving this plan, strategy also weaves HIV research activities across the objectives. Also, calling for the reform of state HIV criminalization laws. And ONAP will be working with communities to figure out what would be most helpful and impactful from the federal government, both the White House and our HHS and DOJ colleagues, to help reform some of these local HIV criminalization laws that get in the way of our overall goals of ending the HIV epidemic. Also, we've learned a lot through COVID-19. We're still going through it, but we've made some changes both administratively in service delivery, also some innovative approaches to ensuring that prevention, care, and treatment services continue. We want to also make sure that we're pulling those things out and that we're figuring out how to embed them into our ongoing HIV response. And then another thing that this strategy does, two other things, looks for opportunities to engage the private sector in our engagement, and also expands the focus on addressing the social determinants of health. We also have, as part of this, because we cannot end the HIV epidemic just with the resources, expertise, and programs that exist within the Department of Health and Human Services. We need a more comprehensive approach to ending the HIV epidemic. And to do that, the White House Office of National AIDS Policy has engaged other federal departments in the overall response. And they too will be submitting implementation activities that highlight for us the things that they're going to do that are going to be helpful when it comes to reaching our overall goals. The other thing that I will say is that many of you who are watching and listening today, you all do this work in your communities and have been for a while. If we're going to accelerate our efforts, a couple of things need to happen. One, we have to do a better job of taking care of ourselves as Black MSM in order to take care of our communities. As part of my commitment this year, my New Year's resolution was that I cannot pour from an empty cup. So in order to continue to do this work that is very important, for me, I have to begin to think of how I refresh and renew myself to be able to continue and go on. And how do I take better care of myself? Taking better care of myself in order to take better care of our community and our nation. The other thing that I think is really important for Black MSM at this particular time, the slides that I showed you about sort of the proportional impact of HIV in the country and where different groups are and where there's not progress, we have to begin to ask the questions about why. Why aren't programs being tailored to be able to meet the specific needs? We have to ask questions about the research agenda and how and where do we show up? We have to ask questions about funding. And so I'll be doing that from my perch in the White House, but I also ask you all as the community to help me get answers to some of those questions. And if we're going to truly end the HIV epidemic, we have to accelerate our response. So not only do we want the questions and the answers, but we want to know how will they begin? How will both at the federal, state, and local level, we begin to accelerate the HIV response for Black MSM so that we can truly end the epidemic by the year 2030. Thank you all for giving me this opportunity to be with you today, to share some updates about the Office of National AIDS Policy. the National HIV/AIDS Strategy, and our goal of ending the HIV epidemic. Stay well, stay committed. Thank you.